healthcare is important to some people some of the time. Public health is essential to all the people, all the time.
I think that's really important that people are being able to build their own opinion by learning about healthcare in this case.
There's a lot about what we can do here locally that I just wasn't aware of. So I'm kind of excited to get out and participate more in the votes. And
Thank you, David. Next we have Teresa Lovelady. She joined the Center for Health and Wellness as President and CEO in 2011. Teresa has been a medical patient at the center since 2003 and served as a consumer board member since 2009. She brought a wealth of experience to the board as a patient and as a professional in the mental health field. Previously, Ms. Lovelady served as the VP of Prevention and Advocacy at the Mental Health Association of South Central Kansas. Teresa has served on National Mental Health America, Visioneering Wichita, African American Coalition, the Boys and Girls Club of South Central Kansas, Wichita State University, Wichita Public Schools, SRS statewide review of, I missed something here. Oh yeah, disparities in the child welfare system and ComCare in addressing needs of disadvantaged persons, particularly children. So she has a wealth of information for you. Let's listen to Teresa.
Well, hello. First of all, I like to thank KMUW for being very progressive. As I sat here when you guys invited me to come, and I think I took the spot of someone else, and I had no idea what I was getting involved in, but I'm so excited about what's happening and what I'm hearing now. So I thank you guys for being very progressive and helping to educate our community, and I thank you guys for being engaged and coming out and wanting to learn more. I always like to start by telling a story. So imagine a community where everyone had the resources they needed to get the medical care that they needed. I know that everyone in this room at one point in their life had some situation or issue where they wonder what's going on inside of me. Where you went to you didn't know where to go or who to go to if you didn't have insurance, but since most of you in this room raised your hand and you said you had insurance, it was as simple as making a phone call, making an appointment. And as David said, getting in the car and getting to your appointment. Not even worrying about your copay. Not feeling ashamed or embarrassed when you walked inside those doors. Not having to have tears of regret or remorse or embarrassment or shame. Not having to worry about what's going to happen to me if it's not as simple as take some cough drops or get some penicillin. Wondering how are you going to go to the Walgreens or other pharmacy or wherever you're going to go to get the medication you need after the doctor has told you what was wrong. Imagine a community where we all came together and supported one another so that no one has to be shamed because they're human and that there may be a time in their life when they need help or support. I can tell you, not being a native Wichitan, I'm from Chicago, Illinois originally, and I've lived in California and Florida. But coming here to Wichita, it was an incredible opportunity. I came and I was embraced, and I thought this was such an incredible place. And then one day I found myself uninsured. And I didn't know where to go, to be honest. I went to the county health department, and it's like, well, no, we do this, we do these, try going to this place. And in 2003, with a 6-month-old, I found the Center for Health and Wellness. And when I went into those doors, they didn't ask me a whole bunch of questions. They didn't make me feel bad. I told them that I didn't have insurance and I knew it was time for my son's 6-month checkup. And I had no idea how to pay for immunizations if you didn't have insurance. I had no idea what I had to do or I knew what I needed to do, but I had no idea what I had to do to negotiate my 6-month-old's health care with anyone. And so as I walked up to the counter and they kind of walked me through the process, gave me the forms to fill out. They had a wonderful program that was sponsored by the United Way of the Plains that allowed my son to have access to health services until his 5th birthday. So every shot, every immunization he needed, every sick or well child visit, everything he needed, I was able to get through them and through referrals to programs through that clinic. That was incredible to me. I didn't realize then at that time what was happening behind the scenes, but it was enough to engage me. So as a patient in 2003 and going and working with the clinic, and when I did get insurance, I was empowered to bring my health insurance card to the clinic so that I can help someone just as the clinic had helped me and my family. And then as I got more involved and engaged to learn more about the health disparities within our community, not only in the child welfare system, but in the different juvenile justice system, foster care system, I found myself always going towards the medical side. Because if you can engage someone in the medical exam room or in the medical community, you can really provide a lot of different types of supports for those individuals. So working through Center for Health and Wellness and working through being on the board, I served as a board member for many years, and then I always say by joke, I ended up in the CEO role because I was, as a grant writer, I was helping to write some grants as a board member, and then I was in a meeting, we were looking for a CEO, and I jokingly said, I guess I'm going to have to quit my day job, and the board all looked at me and said, will you? So I knew nothing about healthcare, but it was a great opportunity because there were so many changes in healthcare around the Affordable Care Act and just a lot of different things that was going on in the kind of political environment around healthcare, not only in the state of Kansas, but across the country. So I got the chance to be kind of ignorant and learn it all from the ground up while it was changing dramatically and drastically. And one of the things that I realized when we look at Medicaid, you know, there were only nobody raised their hand in the room for Medicaid, and I know most people wouldn't just say, oh, I'm Medicaid, you know, because sometimes there is that label of shame or something that people think comes along with it. And I believe that that's one of the fears that we have around Medicaid expansion, because as David said, it seems like it's one of those things that it's a free program and somebody has to pay for it. But if we think about it this way, if we can reduce costs for all by providing access to preventative medicine and preventative services for all, we all benefit. Because if I can save one child, one baby, one newborn baby from going to the NIC unit, the neonatal intensive care unit, for 2 months because they were underweight, and all the other issues associated with that, then we could save the system overall, probably about $500,000 from that one baby. And we could have provided enough prenatal care for that mom, for that family, at a very, very low cost. Probably, I know in our clinic it's $25 per visit. You need about 12 visits if you're going to have a baby. So very reasonable cost. Okay, so we all benefit when we all work together to make certain that we're all covered. One of my concerns with Medicaid expansion too is there is a huge donut hole. We are part of Cover Kansas, and we have navigators that are trained at the clinic to help you get on the new insurance marketplace. And the saddest thing you could ever see is someone who brings everything in and they hear about this ACA insurance and that I can now get covered, and they come in and they bring all their information. Some of them bring their babies and they're there, but they don't earn enough money. So how do you explain to someone that you're not poor enough, but then you don't have enough money, you're not rich enough, so we can't help you? I mean, how do you tell someone that? How do you look at a family and say, we would love to help you, and we know what you're hearing, that you have to get enrolled, and some people are afraid that they're going to have to pay some fee or what's going to happen to my taxes, and there's a lot of confusion and chaos because of what they're hearing, the information that they're getting. But at the end of the day, we have this huge gap where there's 150,000 Kansans that are in that donut hole. So how do they negotiate their health care within this community, within our medical system? The other thing that I wanted to cover also was the impact of the lack of having Medicaid expansion. But if you think about children that are on Medicaid, okay, for a moment, think about a child that's been on Medicaid probably their whole lives. That's no fault of that child. They're on Medicaid. That was their health insurance. That's what covered them, took care of them. Imagine that child turning 19. Okay, I have a 22-year-old daughter who's in college, great kid. She's on my insurance until she's 26. Okay, I have nieces. You know, their parents have Medicaid because there's so many people in the family. They don't qualify for the ACA marketplace because it's based on household income. They don't have health insurance. Okay, when they were in Medicaid and they aged off Medicaid at 19, there was nothing there to cover them. Nothing. You know? How hard is that for an individual? I had a nephew who had juvenile diabetes. Okay, he turned 19, aged off Medicaid. You know, and unfortunately, he's no longer with us. He went to college, went down to County College, was there with his friends, second year of college, second semester, and he went into a diabetic coma and nobody was around, you know. And when we looked at it, he was taking donated medications and he was trying to navigate the healthcare system as best he could with the resources that he had, but there was nothing there. This was a college student. Think about how many of our college students here in Kansas that do not have health care. So Medicaid expansion will allow us to have compassion and care for one another and make certain that our neighbors are taken care of, regardless of if they raise their hand or not, that they had Medicaid or they needed Medicaid or whatever private insurance you have. Because when we help one, when we cover one, we cover all of us in that way, because we never know when it's our child, our neighbor, our friend's kid. You know, we never know. The other thing I wanted to cover was David talked about our safety net system. So there's HealthCore Clinic, it was formerly Center for Health and Wellness. We have Guadalupe Clinic. We also have Hunter Health, EC Tyree, and Grace Med. And together, I think I should have pulled the most recent numbers, but we touch about 200,000 individuals each year through all these. No, I'm wrong there, not 200,000. It's 200,000 encounters, so the numbers could be duplicated because they may go to different clinics. Yes, here in Sedgwick County. So if you imagine, how do you access these services? Like some of you guys know about it because you know the different charitable events and different things we do in the community, but many of you have probably never, do we have any patients of any of these clinics in the room before I say that? Anybody ever went to any of these clinics? There you go. Okay, it's a clinic just like every other clinic. Okay, it's a great place to go. There are different resources that you get from your normal primary care doctor visit. These clinics are designed to really support our community in a way where they go above and beyond, like I said, with transportation, with helping them get access to pharmaceuticals. Because again, if you have a diagnosis, you have diabetes, that's a very expensive chronic disease to manage. How do you get the medications, the insulin, the needles? How do you get the support needed to make certain you're healthy? They have care coordinators, they have social workers, they have incredible support staff that's going to wrap their organization around you. Our safety net system is very important in the city because without that, the cost of healthcare for all of us would go up, if we think about it that way. And then the other thing, I wanted to thank the Medical Society for Project Access. And I know Dr. John Rozelle, I saw him come in the room, but the Medical Society works with, they really go out and they get the medical community to donate services to our patients who are uninsured or underinsured. And it could be, I mean, very simple things. Not only do they provide that service for them, but they also provide whatever tools or medications that they're going to need to get healthy again. And it's not free because they have to really work hard to coordinate these services and get everything done. And I know last year through the legislation here in Sedgwick County, they were at risk of losing fundings to support that. And that's the story of the safety net system. We're always struggling to have the correct or just decent amount of money to afford to provide the safety net system. So why should you guys be engaged and encouraged to vote? Because these things directly impact you. Again, because the cost of care, if it goes up for you, it's going up for I mean, if we don't take care of these individuals and they're having to enter the system where the cost of care are higher, more expensive, it's costing us all. Okay? And then the other thing, I wanted to talk just a little bit about health disparities in Wichita, just our community. We know that the infant mortality rate is measured by the lifespan of a child almost. If a child is able to make it to their first birthday, That's how they measure the infant mortality rate. And in Wichita, it's nationally, for every 1,000 babies born, 6 babies will not make it to their first birthday. In Wichita, for every 1,000 babies born, there's about 16 to 18 that will not make it to their first birthday. And it was something that was specifically for the African American community initially, but now we see the rates are raising for Hispanic women and also for white women in our community. So again, how do we provide access to prenatal care, prenatal services for these women so that they can get, for the babies, so that they can get help as soon as possible and they can get the support that they need as soon as possible. Because if we can provide, again, equal, quality access to prenatal care services, we can identify some things early enough that we can make a change. We can save a baby. We can save a baby. The other thing I wanted to bring attention to is mental health individuals within our community. The state of Kansas has a Health Homes program, and it's a new program that started up in 2014. I think it's about July 2014, but they've been having kind of some tough troubles with getting it off the ground. But this Health Homes program is designed to provide integrated access and support for individuals diagnosed with 8 specific mental health disorders. In our community, individuals with mental health disorders die 25 years younger on average because of unrelated mental health conditions, but those are medical conditions. So imagine if anybody knows someone who has a mental health diagnosis, imagine them being able to go to a medical exam and negotiating their health care. Imagine them being able to be compliant with whatever mental health medication or regimen that they have, but then also have a treatment plan for diabetes or hypertension or some of the other things and the support that's needed. Our Health Home program in the state of Kansas allows private practices and also not-for-profit, just primary care physicians and mental health physicians to really reach out to this community and provide access to integrated services. And in providing that access, they're helping to coordinate and wrap around additional services that's around not only that individual, but also their family, so that they can get the services and support that they need, so that these individuals are getting the correct level of community-based services and care that they need, so that they can stay in their homes and that they're not hospitalized or they're not in prisons and other places, and that there's someone in addition to their family that's looking out for them as well. And I don't know, I didn't see a clock on the wall, so I have no idea. I know you say you tell me, but those are just some things that I wanted to talk about. I know at the clinic, at HealthCore Clinic, we serve about 4,300 individuals each year, and we provide integrated medical, mental health, and substance abuse services. So when you come in for a visit, when we ask you about your family history, we also ask you about any mental health concerns that you may have, and those questions are integrated just in your regular visit. And if there are some concerns, we have on-staff clinical behavioral health providers to provide real-time intervention. One thing we've seen around access to mental health is stigma. Nobody wants to go and say, oh, I think I'm feeling, however. Nobody wants to say that. But if we're able to get some information in the medical exam room, most people will tell their medical provider anything and everything. You're going in and say all kind of stuff, and it's funny now because I get to work with doctors, and it's just very interesting what they, when we brought in mental health services, why they wanted to have mental health services in the medical environment. But what we found also is that for the doctor to go out and tag team the mental health provider, and they both go in the room together and say, we're on the same team and we're going to take care of you because we can't separate your head from your body. We're going to take care of all of you. Great format, the compliance rate for individuals coming back to their appointments and making certain that they get the care that they need so we can manage your depression and your diabetes simultaneously so we can improve your overall health. And that's what our community needs. And I see you looking, Sarah, over there. Our community, for us to all pull together and stay engaged, go out and vote because you can't complain. If you didn't vote, you can't complain. You have lost your right to complain if you don't vote. And go out. And sometimes there are things put out there to remove your right to vote or to limit or different things in that way. don't let anyone discourage you. Go out, go vote. And it's your own personal preference how you vote, but vote. Go out, let your voice be heard. Again, there are so many issues that are relevant here in Kansas with our current legislation that you have to exercise your right to vote, but then get educated too in the process so that you're voting for what matters and makes the most sense in your community. Thank you.